Hello friends, welcome to Sri Netralaya. In this video, I will show you a very innovative instrument, ultrasonic pre-chopper. This needle is developed by Dr. Neha Dholakia mainly for IOL cutting, but we have extended its use as nucleus cutter in a very hard cataracts. So let's begin the case. This is a grade 5 nucleus, a 2.6 mm main incision and a 23 gauge side port incision is made. Capsule is stained and a slightly larger 6 mm rhexis is planned so that I will have more space for following maneuvers. Rhexis is completed. A hydro is done. I need more space for manipulation in the bag, so I would like to debulk this bag of cortical material. So I am moving in with my infinity Phaco machine and taking out some of the cortical material. The purpose of taking out the cortical material is I will have more space for my left hand instrument so that it can go to the equator under the rhexis and I can stabilize the nucleus while cutting it with the ultrasonic pre-chopper. See, my left hand is going inside and that becomes easy if I have slightly less cortical material there and I will get some amount of space. This needle is fixed on a AMO sovereign compact machine with an ultrasonic power of 40, vacuum 0 and a flow rate of 38. Once the needle is inside, my left hand instrument goes below the rhexis to the equator and right hand instrument, that is nucleus pre-chopper, goes deep into the nucleus and then to the equator, cutting the nucleus into two halves. This was a partial thickness cut, so I rotated the nucleus 180 degree and did the same maneuver, and you can see how easily it has divided the nucleus into two heminuclei. Repeating the same process. Again, the left hand is going below the rhexis and holding the nucleus stable, and the right hand is going deep into the nucleus and cutting the further pieces. Sometimes you may find going deep into the nucleus slightly hard. Here you can utilize a sharp chopper and stabilize the nucleus and then insert the pre-chopper tip into the nuclei bulk. The ultrasonic tip here is a very small and it don't have a large bore. So even though you use ultrasonic power more while performing this step, it does not cause much of an energy dissipation in the anterior chamber and thereby saving a lot of endothelial cells. Now we have 4 pieces in hand. You can note this is a very hard cataract and very sticky too. It is a diabetic case and grade 5 nucleus. To cut this nucleus with a routine phacoemulsification is very difficult. If you have pieces ready like this, it will be much less ultrasonic energy delivered into the tissues and thereby causing less endothelial damage. Once you have these 4 pieces in hand, the surgery following becomes very easy and the total energy delivered into the tissues is very less, thereby benefiting the patient. Now you can see that my job has become slightly easier. Though the pieces are not completely separated in this particular case, still the total energy delivered will be much less than a routine case in such case scenarios. I am just debulking the nucleus as it was still a very hard nuclei and dividing it further into the multiple pieces, taking out each piece, separating that piece from rest of the pieces and taking it to the iris level and trying to finish off each piece separately comfortably. You should hold the left hand instrument below the endothelium so that these pieces should not touch the endothelium while performing phacoemulsification, and these small pieces can sometimes lead to a reason for corneal edema even with a best possible machine. Here you can see how hard the nuclei is. It is very tough and very gluey. It was a very sticky nucleus, and to perform phacoemulsification in such case is a very difficult. A clear cornea following these type of cases is not easy. I am almost done with my phacoemulsification, taking out the cortical material, and the epinuclear plate is very thick. So these type of epinuclear plates should be taken with phacoemulsification with foot pedal position 2. Once this is done, anterior chamber is again formed and IOL is injected into the bag after cortical wash. I hope you enjoyed this case. Thank you and good day. Do subscribe to a YouTube channel Dr. Pankaj Landai for more such exciting videos.